Okay, so for my clinical strengths, according to CO6, apply legal requirements and ethical principles in decision making for healthcare management of individuals and family. This is one of my clinical strengths because I know that a patient needs to be competent to make their own decisions. And if there is a POA, especially a medical POA, if it is different than a financial POA, then those are the ones who get to make the decision, even if it's not the son or daughter of the patient. If they have a medical POA, then they get to make the decisions. Unless the patient specifically has something written in their will that says, this is exactly what I want, then that will is to be followed. I also know that there needs to be consent for invasive procedures, including blood. If there is not consent, then this cannot be done unless it is an emergent situation. This also goes for, like, example, if a patient is a Jehovah's Witness and they do not want blood and it is listed in the chart, then it is ethically wrong that if someone does give them blood because their wish is to not have the blood because of their religion. And then according to CO number 4, which is another one of my clinical strengths, it says apply pharmacologic and non-pharmacologic interventions in the healthcare management plan, for individuals and families across the lifespan. I think about this especially with hypertension and for stress incontinence. For example, with stress incontinence, patients can do Kegels, which are exercises that will help with the stress incontinence. That way they don't have to take medications such as, or even for BPH, they don't have to take medications such as Flomax or Myrbetriq or Oxybutynin. And then also, if a patient has a headache, that could also mean that they are just dehydrated and that they need water, not necessarily that they need Tylenol or ibuprofen. If they take the water, it might take it away, which then is a non-pharmacological approach to getting rid of the headache. Also with this, you can include, if there's pain, ice and heat, because those are also not medications that the patient has to take to resolve the problem that they're having. And again, this could be like blood pressure. If a patient has high blood pressure, it could be due to the foods that they're intaking because it's high in sodium. So they could change their lifestyle, or if they have heart disease, they could start increasing their exercise. If they don't have very much exercise in their daily routine, they could also watch what they're intaking for food wise. Is it high of sodium? Is it a lot of fried foods, fatty foods that are creating this, bulk of a plaque in their body? So with the improvement, though, there are also areas of improvement that I need to improve on, which I am totally aware of. And examples of this is MO4. Examine the development of accurate SOAP and progress notes and patient presentations. So for this, I don't feel like we had a lot of practice for SOAP notes and progress notes during our schooling. And so I really need to improve on this because I haven't done it that often, especially because as a nurse, you don't really do SOAP notes. So my plan to resolve this is to review the examples that are given to me and the videos in the class that will help show what needs to be done to make these effective and correct notes, and where you need to put patient presentations, where you need to put subjective information or objective information. And then also, I've been following my preceptor and kind of watching her make her notes, because she does do SOAP notes and progress notes, and kind of see what the difference is when she does write her notes, and how maybe a consult note is different than a follow-up note. And when she's doing it, I'm asking questions like, why are you putting this here? Why does this go here? Why aren't you including this? Or why are you including this? And, sometimes it's just like, oh, it's a mental note to myself, like, this is done. This is why I'm doing it. This is what we're doing next time. And I'm putting it here because this is the diagnosis. But I'm also putting it here because this is where it makes sense as well for the plan, which did make sense. So I think doing more of these SOAP notes and progress notes during the practicum portion of schooling is going to help, but also like reviewing the videos and examples that we get, and also doing these notes and then having my preceptor or even a professor look at them and tell me what I can improve on will definitely help me improve this. And then another area improvement would be recall concepts and skills required for national certification for Module 2. So for this, it's really hard, I think, at the end when you're just doing clinicals to remember everything from the beginning of schooling, and kind of correlate it all together. So as we're going through practicums, especially this first one, my preceptor's kind of giving me examples of questions that the boards will ask in the situations that our patients have. For example, like if this is happening, what would you order? If this is, if they're having, for example, pain, is it more of a ureter problem, like if it's a stone, or a kidney stone? And that should most likely be a ureter stone because they're having pain, and kidney stones usually don't cause pain. However, if it's certain size, then would they be able to pass it, and what's the rate percentage of likelihood that they would to be able to pass it? And then I've also gotten some books under their recommendation to help me study for the review boards, and I plan on starting that now and not waiting until after school is done. So I have purchased things like the Kaplan Review book, UWorld Questions Online, and there's a really good book by Leak that some of my preceptor and their coworkers have told me about, which is the Family NP Certification Intensive Review book. So I do have most of those coming Friday. So as soon as I get here, I do plan on reviewing those. And if there's questions that I have that I really don't understand, hopefully there's a reasoning why the answer is correct on the review. But if not, I definitely plan on asking my preceptor or professor or someone who's in the field to be like, hey, I don't understand why this is correct. Why is this the reasoning? So those are the two main things I need improvement, but I also want to help correlate what I've learned in class to the clinical field. So I'm doing that more and more, this moment, okay, this is leading to this. For example, if a patient has diabetes and they're on Jardiance and Farxiga, that can increase their risk of having gangrene, Foreigner's gangrene, which my preceptor and I saw in a patient that got admitted to the ER, which was kind of a full circle moment. So I really like doing that. I think that will actually help me, correlate everything together and help everything stick.